All right, welcome to episode number 3. So today, you know what? I really got to get that like really cool intro music before podcast that makes you seem like really a lot cooler than you are. Like, ooh, this is his podcast. But for now, we'll just keep starting them like this, I guess. But today's a little bit different. Today, you're going to be listening to a recording of a masterclass I gave on chronic pain. And let's just define chronic pain as persistent, uncomfortable symptoms. Doesn't have to be pain. It could be dizziness. It could be irritation, sensitivity. We're going to call it all pain of the head, neck, and jaw area. So chronic pain, persistent symptoms, whatever you want to call it. But the talk was how to fix the intersection of body and brain. Because when you have symptoms that have lasted 3 months or longer, it's not just your body, like your fascia, your muscle, your joint, your spine, the way you're moving. And it's not just the brain, like I need to talk to a psychiatrist, I need to meditate, I need to regulate my emotions. It's a combination of all of it. It's one system. We like to break it down in our society into two, but it all interplays with each other. So Dr. Nicole LePera, who's known as the holistic psychologist on social media, asked me to give this talk to her private community. And after the talk, I thought it went well. I said, you know what? I'm going to give it to my revitalization program members because I have a community and it's based around a 12-week program to fix head, neck, and jaw pain. And normally, and every week I do live calls with everyone. And once a month I do a masterclass. And this was the masterclass. Now, normally, I've never released a masterclass to the public, but I figured since I already gave this one outside of the program, I would just release the audio of it, not, so you guys get to listen into the whole thing, because I do think it'll be powerful to understand what we're doing here. Like, how are we addressing these symptoms? And it's with this body-brain approach, which I'm going to break down. Plus, you're going to be able to identify which of the neuroplasticity or brain aspects is impacting you. And there's going to be strategies that you can try right away by the end of this podcast. So I'm excited for everyone to listen to it. And yeah, here we go. I'm going to play it. Okay. So today we're talking about chronic or persistent ongoing pain or discomfort, pressure, dizziness, any type of, we can just call it pain, and how to fix the intersection of the body and the brain in order to address it. So if any of this sounds familiar, right, you've tried multiple different treatments, you've had relief, but it always comes back. Or you've been told everything looks normal, but that doesn't explain how you feel. You're like, okay, great, that's awesome. Everything looks normal. Doesn't help me because I still feel like crap. You understand the mind-body connection maybe. Maybe you spent some time learning it, but it hasn't really changed too much for you long term. Or you feel like you're chasing relief. So, I'm better, I'm worse, I'm better, I'm worse, instead of actually getting better. That's what we want to touch on. Now, most approaches treat one side of the body. That's one of the problems. Either the body only or the brain only. And body-only approach would be physical therapy, chiropractic, acupuncture, using a brace, using tape, getting a surgery. This is focusing on the body and what's wrong in the body. And then there's the brain approaches. Oh, I see a psychiatrist. I work on meditation. I do group therapy. I try to calm my brain with medications and etc. Vagus nerve stimulation, whatever it may be. And neither of these really work alone. In some cases they do, of course, like everybody's different. But what I find is that a lot of people who are stuck, the missing piece is the connection between the two. And if you think about there being something wrong in your body, like a muscle's too tight, a joint is restricted, you're not moving properly, your body sends a signal up to the brain, and the brain interprets the signal, and that's what only your brain can decide if you have pain or not. And if it thinks that that signal is worthy of pain, it sends the signal back to the body for you to feel pain there. So if something's wrong in your body, then ultimately you're going to feel pain. But because the brain is the interpreter of all of this, sometimes there is no injury, or things recover. But if the brain and normal signals get sent up to the brain, but if the brain continues to misinterpret them for one of many various reasons. And it still has a fear that something dangerous is going on, because that's why it gives you pain, to notify you. It can be notifying you of something that's actually in the absence of physical injury. And so if you have a body dysfunction, you'll have pain. But if the body's fine and there's a brain dysfunction, a neuroplasticity dysfunction, you're still going to have pain. So we need to get both working together. That's the loop. That's what we have to fix. And when I think about treating one side of it, like the traditional medical model, we see that I envision it as like a raging river going in a circle, and you're standing at one part of it with a bucket, like trying to scoop it out, right? That's like oh, let's just address that. Let's just inject this. Let's just stretch this. Let's strengthen this only, right? You're just getting one piece. We need to actually reroute this with more all-inclusive strategies. Now, kind of like I said before, you may have studied the body and brain, or been actively trying to, you may have learned different concepts and said, oh, this is really interesting, but it may have not helped you feel better. Well, the way that I kind of figured this piece out and started implementing it was my own personal experience, where I started having neck pain on one side. This turned into headaches. And I actually took a couple of days off work, and I said, okay, let me just kind of let this run its course. And then when I got back in the car to drive to work a couple of days later, I remember I started getting motion sickness, and I was like, what is happening here? My eyes were really sensitive. Like I wanted to put sunglasses on. I felt like I was on a boat. And then when I started working again, I started feeling brain fog. Like I started napping during the day. I was exhausted. And this is someone who I was always extremely high energy. So I started experiencing this. I wasn't sure what the cause was. A few different things had happened, but I wasn't positive why this was all happening. So what I did was, maybe some of the things that you guys have tried. I saw a functional medicine doctor. I went on all these different diets. I did like the FODMAP diet. I did a elimination diet. We did all the tests. Allergen tests, micronutrient deficiencies, all that stuff. And some of it made me feel better for a little bit, like especially, if you clean your diet up, you're going to feel different. But then again, it just didn't make it go away. I did physical therapy, all the stuff that I do. I even had chiropractic adjustments. I would get massage into those areas. I must have been to the gastro, the ENT, neurologist so many times. I'm like, you got to find something. They're like, nothing's wrong with you. You're not dying. But again, it doesn't make you feel any better. And so a couple things actually created a shift for me. The first thing, actually, when I had my daughter, although my wife did all the heavy lifting, I still had to sleep on that recliner some nights. And I thought, you know what, all this rocking and sitting in a recliner, my head being forward and everything being out of position, this is going to really kill me. This is going to hurt a lot. But like for 3 months, I had zero discomfort. Everything went away. And I was like, wow, that's so odd. And then what I realized is that when I had my daughter, all of the focus went into that. That's all I was thinking about. So I was just like, I need to work. I'm going to get home. I need to be with my wife, my daughter. I didn't have time to think about the symptoms. And I started realizing, wow, like my attention just shifted away and everything went away. And I just thought that was really interesting. It did come back though. And then another time I had been going to the doctor, and he was like, all right, look, we did the test again. Nothing's wrong with you. He's like, I need you to go home. Don't do any more tests. And it's it. You're fine. And I again had this experience where I felt better for months, because he gave me permission to stop worrying. So I felt like when I had my daughter, I just didn't have time to think about it. The doctor was like, he gave me permission to just not worry about it. And once that emotional component came out of it, all of a sudden I was like feeling so much better. I said, wow, that was another kind of eye-opening thing. And then I was, I'm always doing courses and learning about the body and movement. And one of the mentors that I had, he taught a course, and then I was like, you need to give me your cell phone number. He had been doing what I do now for like 50 years, and talked to them a lot. He's like, you need to take people towards the pain. It's like, wherever your pain is, you don't say, all right, we're going to avoid that until everything feels better, and then you can start doing it again. Or, like if this is triggering you, that's not for you because something bad's happening. He had this approach of go towards the pain. Actually, like, if that hurts, let's do more of it. Maybe we need to manipulate it. Maybe it needs to be less intense, less often, less frequent. Maybe we need to do it with a different mindset, like remove the worry, like different environment. Let's explore it, because there's a lot of fear of the unknown, and maybe you just need the right situation around the movement. And I thought to myself, it's kind of like, it's like anything else. If you encounter something that's produces discomfort, like with your career or home or work or exercise, but especially like learning experiences, when you have something new you're trying to learn and you're like, oh, what is this? Oh my God, what are these terms? Like, how does this work? This is horrible. But then you start going into it, and in a few weeks, all of a sudden it becomes normal. So it's like by persisting into that pain, things like open up, and you can sit in it, and you're like, I can deal with this. Like, I can figure this out. He was like, you need to switch your mindset like that. So obviously, as this is all happening, I'm working with patients with TMJ, headaches, neck pain all day, every day. It was just coincidental that this happened to me at the same time. But between all of my learning, all of my studies, all my working with people, then this happening to me and being able to relate to them, and then noticing, again, having my daughter, and I didn't have time to think about it, that got better. Then the doctor told me, don't be emotional about it, like, you're fine, that got better. Then starting to go towards the pain, that got better. Again, none of them worked because they were all one-off random approaches long-term, but they created like a curiosity and a shift. And that's when I started trying to figure out how to leverage this into a system. And so that's, to me, that's what we're all trying to do. Everyone who's part of this program, everyone I've worked with, anyone who listens or watches me, like, I'm trying to systematize this and make it perfect. And that's what everyone's a part of. So let's just break down what neuroplasticity is. Neuroplasticity is, the definition is the brain's ability to learn from and adapt to new experiences. More importantly, how you interpret what happened. So something happened, how do you interpret the experience? And that brings me to the framework that we use in the revitalization program, which is ETA, which is emotions, trust, and awareness. And this is kind of embedded in everything. And now you kind of know the way it's set up. So the first piece is emotion. So think about if you had two friends and you forgot both of their birthdays. The one friend is like a very emotional person, quick to like kind of snap and like, how do I, kind of has like a victim mentality, just like very fiery. And the other person is like super chill, relaxed, and you forget both their birthdays. The person who is just relaxed and understanding will say, like, oh, he's busy, career, kids, it's literally a non-issue. Whereas the other person, if you can forget their birthday, you might get a little more of like, you know what, everyone does this to me. They always forget about me. And it's the same experience, but it's interpreted in two different ways. And it's the same thing with your pain. The way that you actually interpret what's going on completely dictates how you feel about it. And there's a physiological effect to that as well, which we will get into. Now, the other piece is trust. So trust is, I want you to think about this, like, it's called a pain mountain. So let's take the neck. As you move your neck to a certain point, if you move it far enough and it gets twisted far enough, you're going to have an injury. That's your damage zone. So what does your body do? It gives you pain before you get there. So before you get to that area, it gives you pain to say, hey, slow down, don't do this, I'm telling you. So it gives you pain to warn you. Now, if you still have injury, if you go past that pain for whatever reason, maybe you didn't do it, maybe it was like a whiplash, whatever it was, you have injury. Now your body says, whoa, you know what? Last time I told this guy, I gave him pain right before the damage was going to occur because I trusted he would stop. But he didn't listen to me. So now I'm going to give him pain so early. As soon as he moves his neck, I'm giving him pain because I don't trust him. So he stops moving. I'm going to give him a lot of it too. So now every time you move your neck and your body, you have all this pain. And you're like, oh my God, something's broken in there. Something horrible is going on. It's getting worse. What's going on? I need to go to the doctor a million times to do imaging. And you may not realize that it's, in this case, I'm not saying all cases, of course, there's times when things are wrong, but in this case, the body you've broken trust with the body, and that's how the nervous system tries to protect you. And we need to rebuild that trust. And the other piece is awareness. So this, have you ever been shopping for a new car? Maybe you never noticed this car before. You went to a dealership. You're like, oh, that's nice. Maybe it's in my price range too. Maybe I'll get that. So I'll think about it for a day. And then you drive home, and on the way home and the whole next day, what happens? You start seeing that car all over the road. Now, did everyone just buy that car? No, of course not. but now you're tuned into it. It's in your level of awareness. And this happens with injury. We tune in, we think about it. You wake up, am I in pain? I'm putting my shoes on. Am I in pain? I'm having breakfast. Is it going to be a painful day? I'm in the car. Am I having pain? Am I dizzy today? You start think. And you're driving it. You're creating a super highway. And so hurt does not mean harm. If something hurts, it doesn't automatically mean there's something injured in there. And that's the ways that I've found that we can put people into buckets. It's all of it, but which one really could be more so for you? And you can ask yourself those questions. We'll get into that. So we have emotions, how your emotional state sensitizes your system. Trust, how the brain stops trusting the body after injury. And awareness, how to redirect the brain's attention away from discomfort. So that's the neuroplasticity brain side of the loop. But then we have the musculoskeletal side of the loop. That's the opposite side. Now, musculoskeletally, you could have soft tissue imbalances, muscles, joints, fascia. They're too tight. They're too loose. They're not in the correct state. And your body sends that information to the brain to interpret. Okay, it sends those signals to the brain. And so the soft tissues can cause problems. Then the spine connection, right? So the nerves exit your skull, they go down your spine, they exit into your body. If there's any type of problem at the spine, whether there's a tightness or restriction, an area being overused, it will make you feel pain in a different part of your body because it's all like your hand is represented at a certain part of your spine, your foot, and so on and so forth. And it sends that information to the brain, and then your brain has to interpret it. So the spine is another way that you can experience discomfort. And then movement patterns. Okay, so my soft tissues I'm fixing my soft tissues, I'm fixing my spine, but now how you coordinate movements from head to toe impacts how you feel. Because if you end up overusing one area because another area is too tight and weak and you compensate, etc., things can happen, and it sends the information to the brain, and then that can be another way that you experience pain. So we have the soft tissues, basically what like moves and connects your body. We have the spine in the center that sends the signals, and we have the way you move it all together. So again, we need all of this working together. And so we have a comment here. Tyler said, love this. What is in the way is the way. Yes, it is 100% true. And a lot of times we understand that in all other areas of life, but sometimes we don't think about that in the way of the body. I mean, you think about it, the fear of the unknown. And then once you get to understand what it is, you're like, what? And that's not scary. It's amazing. I can go into a whole nother tangent about the unknown, but it's amazing how intriguing and scary the unknown is. And then once it becomes the known and you investigate it, it's not interesting or scary. But our mind just builds up these crazy things. That's the way TV works too. You ever see like a trailer right before the season finale and they're like, this happened, and then this is going to happen, and this, tune in next week, and you're like, oh my God, this is crazy. Like, what's going to happen? Oh my, did you see that? We got to go watch that. And then after you watch the episode, you're like, oh, that makes sense. Yeah, that was interesting. Like, it's completely not as interesting as the curiosity in your brain. Same thing with fear. Okay, side note, I don't want to get distracted. So the question is, what's the biggest lever we can pull to feel like yourself again? It's all working together. This is all interplaying. But which one should you focus even more on? So the first piece is emotions, right? So let's get back to emotions now that you know the framework. Does this sound familiar? You're confused by different explanations from doctors. You've had multiple frustrating failed treatment attempts. You're concerned about continued personal or job responsibilities. You're talking about your issues. Talking about your issues or being asked about it is triggering. It gets the emotions going. This is the emotions loop at work. Now, what do we do so as you'll see a screenshot from our revitalization program here. But if you think about in this module, if you haven't got here yet, not to ruin it for you, but if you can close your eyes right now, everyone, you could think about, imagine you're on a beach or at the pool in a vacation spot, you're relaxed, the temperature is perfect. You got a hat on, it's blocking the sun, and maybe you had a pina colada, you're perfect. And all of a sudden someone goes like, dog, and you open your eyes, there's a pit bull running full speed at you. Think about how your body would change, the shift that would happen. You would get goosebumps, you would stand up, you would like scream, you would run. What's happening in your body is your stress is created, cortisol and adrenaline spike. This sensitizes your nerves and your blood vessels constrict, the blood vessels in your outer tissues, okay? Because like the ones to the vital areas for fight or flight open, but the smaller ones constrict. And then you don't get as much oxygen to those little smaller ones, and pain signals amplify and tissues ache. Now, if you're always in this emotional state, even at a baseline, 5%, 10% throughout the day, you're always in this sensitivity. You're always getting that little bit of worry. You're sensitizing the nerves, blood vessels constrict, pain, tissue aches, and you're always feeling more of that pain. And then if you feel like, if you've been noticing anything starts triggering your pain nowadays, so it's like blood flow, anytime I move, anytime I get exercise, walk fast, turning my head, my body, if I get sick, if I'm stressed, if I get into an area that's too cold or too hot, it all starts triggering my symptoms. That's because these same sensors run through the same nerves that dictate pain, so everything gets wrapped together and sensitized, and so other things start triggering your pain. And so with this, we really look at what's filling up your cup. Maybe you've had, like I said, the failed treatments, different explanations, job responsibilities, personal mindset at the time of the injury, like what were you doing? And what happens is when you have enough of these things that are always filling up your cup, it only takes one little extra ounce to spill it and create your symptoms. And so if it's like you and a coworker and your boss just gives you like a huge deadline the next day and his cup was empty and your cup was already almost all the way full, you end up with a headache or dizziness or jaw pain or whatever it is. And they end up fine. You're like, how come they're fine? Because they were starting with an empty cup. And so we always have to fill up, empty your cup. Now, one tool that we can use, and it came with your program, is the pain diary. So it's always a good tool to revisit and just look at what's my pain level. In the morning, you could split up your day in half, morning, afternoon. What's my pain level yesterday in the morning? Where was my pain? What was my stress level that day? What was the primary position or task I was doing? I was sitting, I was on the move, I was talking, whatever. I was exercising. You could even add in, was I eating junky foods or did I get good sleep? And then you do this for every morning. You split the day in two, morning, afternoon, and do it for a week or two, and then start looking at patterns. Every time my pain spiked, was it a position? Was it stress? Was it, an appointment? Like, you can put as many categories as you want without diluting it too much. But this is how we start gaining information. And there's a really interesting study that showed a woman laying in a brain scanner with no pain, and then she was asked to move her back, because that's what she had, a history of pain. And all in the brain scan machine, the areas for pain lit up. But then after they went through education for the emotions piece of it, and they had to do the same movements, and in the scanner, there wasn't as much pain lighting up. And it showed that the educational piece worked. So that's the emotions piece. That's how you know if it's you. That's the way it works. And that is something that you would benefit from working on if that's you. Okay. So then there's the trust issue. So do you avoid certain movements because last time you tried, it flared up? Or do you feel tighter and weaker than before the pain started? Do you brace for pain before it comes? Or you've been told, just move through it, but it never gets easier. That isn't weakness. There is weakness present because of all this, but it's a brain that stops trusting the body. And then these are things that I find show that it's more of that trust issue. Something you can do with this is reprocessing with light touch or tapping. So if you touch the painful area, it activates these A beta fibers, which block pain signals at the spinal cord. And then the brain updates the body map and lowers the guard, because the brain says, oh, this isn't all bad here. We like this feeling. And so it starts communicating with that area better. And this is just like if a kid falls down and he runs to mommy and she rubs it or she kisses it, right? It's just touch overriding those pain signals. And the more we do this, the more we normalize the area. You complete like 2-minute sessions of this several times a day to get the sensitivity down, so your body can say like, okay, there can be normalcy here. Maybe we can move this area. Like maybe it's not as bad as we thought. We're rebuilding trust. And you can even take it a step further with visualization and graded exposure, so which rebuilds motor pathways. And it reduces protective pain responses. So if you have a movement or an activity that really triggers you, what you can do is you can sit there and you can visualize yourself doing the movement prior to when you ever had any pain. Or remember, pain is just a word I'm using for any kind of symptoms, in case some people are here like, oh, for me, it's my ears, my eye, it's dizziness. But you visual, and even some people have a photo of them doing the things that they can't do now. You could even visualize, stare at that and just imagine what that was like. Then you start actually, oh, I have it actually written down here. Then you start doing micro movements. So with the eyes closed still, you start doing 10 to 20% of the full range. Stay relaxed, stop before discomfort. And then you slowly transition to full movement. Slow, controlled, with awareness, not aggressive. And then we can add resistance over time. And you want to be checking in. Is it better? Is it worse? Is it the same? We track it. And like little wins, we celebrate. But we build up over time. That's part of the progression that you go through here in the program, where we're just building up. And we just need to kind of meet the body where it's at. But if we start with visualization and build up slowly, the body again starts building trust. It's like, imagine you went on a first date and on the first date, someone proposed to you. You're like, well, okay, you're crazy. See ya, right? But if you went on 10 dates with them, hopefully it would take more than 10 dates, but not judging you if 10 dates is your limit before accepting a proposal. But if you dated them for a while and then they proposed, you'd be like, okay, this makes sense. You know, I got to know you. This is normal. That's the same thing with the movement. We can't just ask it to do this big movement when it's been a problem in the past, when it's new. We need to build up. So that's what a trust problem sounds like, and part of how we begin to approach it. And then there's awareness. So remember, ETA, emotions, trust, awareness. So awareness is, tell me if you recognize any of these. You wake up and immediately scan your body to see how bad today is going to be. You notice pain more when you're not busy or distracted. Some days are fine, but you can't figure out why and you can't recreate it. It's like, well, how could that possibly have just been a good day, right? Because maybe you happen to not be focusing on it that day, or you've become hyper aware of every sensation and it's spreading to new areas. That's a classic sign as well, because where your brain puts its attention is where it finds pain. Something for this we can do to disrupt awareness is a sound scan. So with the sound scan, I want everyone who's watching and listening right now, try this. Close your eyes. And I want you to scan the room or environment for as many sounds as you can name. Let's take a second. Okay, so I heard footsteps and like someone talking in another office down the hall. And I hear a humming, which I think is my computer. So put in the chat what you could hear. And while people are putting them in there, I wanted to ask you if during that, did you also feel your pain? Because most people are going to tell you, oh no, I wasn't experiencing the pain at the moment, because you were so deeply invested in focusing on something else. So we can shift awareness. And what this sound scan does is, because our attention shifts to sound, our reticular activating system now prioritizes that. Because we're focusing on it, it says this must be important. So it brings us to the top of the list of what you are going to experience. And so you're interrupting that loop. And so the brain, if you did this constantly, you're always scanning for sounds, the brain would learn it can focus elsewhere. So like imagine you were, imagine you were in the military and you were like in the woods and some kind of guerrilla warfare, and you're just sitting there and you have to scan for every sound. Did you hear a twig break? Did you hear, right? If that was your norm and you were in there for months and months and months, your reticular activating system would say, whoa, hearing different weird things in the woods is extremely important to our survival. We're going to be we're going to be able to tie our shoes and still be focusing on that. Well, when we're thinking about our pain all the time, a reticular activating system doesn't really care how like comfortable we are. It just wants to keep us alive. So it just thinks we need to focus. This pain is important. So it keeps letting it through. And it's really, really important. So we had some people saying they heard cars, computer systems, people all around, and shifts for a moment, but today was very stressful, so pain is louder than normal. Julie said the dishwasher, bird, cat moving. Tyler said dishwasher, car moving, my computer did not feel my pain. Right, so there's real power in all of this. And neuroplastic strengthening, which is in the revitalization program, which will come later in the program for anyone who's still in phase 1, where you're going to, if you take an object and you focus on it, you take it something visual that you can close your eyes and think about the color and the texture and like just imagine looking around all sides of it, and you try to focus on it for a minute. And every time the pain or symptom starts coming in, you just say, okay, I'm doing something else. I'll deal with you later. And you see if you can get to 30 seconds, to a minute, and longer without focusing on the pain, because it is a muscle we can flex. You want your biceps to be stronger, do biceps curls. If you want your brain to be able to resist a thought, use strategies like this. You think about, we use our brain to resist things all the time. As some of us more successful than others, or sometimes we're more successful than others, like we resist sugar, right? We try to resist too much alcohol or tobacco. We resist really bad behaviors because there's a lot of behaviors in society that we know are bad for us. Like they're not going to contribute to our survival. So we like put a lot of effort on resisting those. But for whatever reason in society, we never talk about like resisting thinking about pain. But it's a real detriment if you're constantly focusing. If you just let it in, like, what can I do? It's just pain. And like, I need to tune into this. I think there's just a lack of, and it's very difficult. I'm not saying it's easy, but there's not a lot around that say like, hey, you should resist that just like you would resist cookies before bed, or like drinking, a 6-pack of alcohol every single night. Like you should probably resist it the same as, it's like resistance to the exact same amount. The same way that you're like saying, no, I'm not going to smoke a pack of cigarettes today, is the same resistance you should say like, no, I'm not going to just let my pain win. It's going to win sometimes, but like there's something we could do about it. So again, this is a loop between the musculoskeletal system, the body, and the neuroplasticity system, and neuroplasticity, the brain. So we just went through the emotions, what it would be like to have a problem with the emotional aspect, and ways that we could just begin starting to alter that. We talked about trust. What do it mean to have a trust problem with your brain and movement, and what we could begin to do to adjust that. And awareness. If you like, what would it be like if you have an awareness problem, and what could you start doing to begin resisting against that? And to just touch on the musculoskeletal piece of it, we have soft tissue imbalances, the muscles, the joints, the fascia. It's all real stuff that we need to work out. We have the spine being out of alignment and not moving properly and referring pain different places. And we have movement patterns. That takes all of it together. It takes the soft tissues and the spine and the posture, and it moves it into coordinated effort. Think about a movement pattern. Think about a sport like golf. We could talk about Tiger Woods, who seems to not be in the best place in his life right now, and your average golfer. Why is he so much better? Why? He was never that big of a guy. He started lifting weights at some point, but he could drive the ball so far. Why? Because his movement pattern was so dialed in that he could put together the perfect, most efficient swing to smash a ball straight and far. And someone else who is stronger, faster, genetically more gifted, can't do that because their body doesn't know how to coordinate movement properly. And that's the same thing. And so that his goal was to have a low score in a round of golf. But if your goal is to not have pain and symptoms, we need to retrain the way you move efficiently. So again, all that information gets sent to the brain, and that's that one side of the loop. And once it gets sent to the brain, then it's up to the brain to interpret it, which we just went over. That's all the different ways that it can interpret through emotions, trust, and awareness. So musculoskeletally, we're not going to go as deep into in this talk, but we are touching on it. The first thing we need to start doing is So actually, let me go back real quick. With soft tissue imbalances, we may use muscle primers. You know, we may stretch the fascia in different ways. We may start to do some strengthening. We may activate muscles that turned off. They stopped working, and because of that, your body's not functioning properly. It has pain. The spine, it may be out of alignment. We need to do these corrective movements where we repeatedly put the spine in better position. We need to hold it in a better position throughout the day. Like, we have to open up the nerves, different things. And movement patterns is like functional movement pattern retraining. So these are strategies we can use. But overarching concepts are going towards the pain. Again, if you're having one movement, task, or pain that's problematic for you, we have to test doing, we can't give up on it. We may have to change the intensity, so how hard we do it, the duration, how many sets and reps and minutes of it, and the frequency, how often we do it, until you can find the tolerable amount, and then we can start modifying it as we move forward. We also have to control the variables. So when you've had symptoms for a while, you want to only, anyone who's in this program or listening knows that a day turns into a week, turns into a month, turns into a year with this kind of thing. So if you just got in pain, if you're like, oh, I had whiplash last week, do whatever you can to get out of it. You forget controlling the variables. Throw some heat on it, stretch it, like try things. That's fine. But if it starts lingering, which I know most people who are watching this is the case, now we need to be a little smarter, because if we throw 5 things in at a time, new different approaches, and you're not better in 3 weeks, we haven't learned anything. So we just lost those 3 weeks, and now we need to start over again. And so we need to add one thing in, see how your body responds, and sometimes quite literally one, but other times we have just like a set program we do for a week, and then we change one thing, right? And then we listen to the body, and that's how we start gaining information. You may not solve it in week 1 or 2 or week 4, but you've learned what doesn't work. Half the time, figuring out what doesn't work ends up being more powerful in the beginning for moving forward to get things to work. I had one person at my clinic. I have one bad review. I have one bad Google review, and this person said, "I don't understand why what we did was so basic. I went there, and he sent me home with like 2 exercises, ones that I had seen before." And I wrote, of course, I was like, that night, I couldn't sleep. I was like, oh my God, it's terrible. And I wrote a response back, and I said, listen, there's nothing magical. I'm not going to have like a magic fix for you. A lot of times it comes down to fundamentals, and it's the things you've already seen a million times. But the reason you're coming to see me is to figure out which one is right for you. And if it doesn't work, that we still can't give up on it. We may have to manipulate it and change it and to get it to work for you. I can't tell you how many people that when I find something that works for them, they said, oh my God, I tried this 2 years ago and it hurt, so I didn't do it again. I'm like, yeah, because it's not just about the all or none of it. It's about tweaking it. And sometimes it's not always complicated like that. Sometimes you can in a week or 2, you're feeling amazing. Some people take 4 weeks. Some people take a full 12 weeks. And then, yes, there's people that linger a little more and it's more difficult and we need to figure it out. But just so you know the concept, I'm kind of rambling now. And then there's progressing at your body's pace. So I kind of combine this into 2, but you control the variables. We implement new things, but then progressing at your body's pace. Some people are going to be able to tolerate more than others. So we just listen to what the body gives you back. And some people, you need to do the same things over for like 3 days. Some people need to do the same things over 3 weeks. Some people touch the muscles to release them, do muscle primers, and it is so sensitive they could barely touch it. And it takes 2 full weeks to work through that. And some people in 2 days, they're like, can I go harder? So we just listen to your body. So we go towards the pain, which is a compass. We control what we're doing, and we progress at your body's pace. And the big thing that all this comes down to is, what's your lever? We have to work on all this together. And in this program, it's all thought out for you. You don't have to like start doing math and adding things together. And that's based on a sheer volume of like how many times I've went through this process. I know the general protocol that everybody's going to go through. But then we may find that someone has to do more of the muscle primers. Someone has to do more of the corrective movements of the spine, and someone needs to do more of the movements. And we may find that someone needs to focus more on the emotions, someone needs to focus more on the trust, someone needs to focus more on the awareness, and you just pull that lever, and it's just like, and like things unlock. So again, I don't want you to get overwhelmed. This is my like scientific brain trying to break everything down. This is all kind of seamlessly built into what we do. But everything comes down to your biggest lever, like what's going to help you. And that's your part in the recovery, like listening to your body and learning, and then bringing your questions to me, or remembering that it's just a big piece of it, and it all fits nicely together. So for anyone, this is what I tell people who listen to this talk who aren't in the program. It's like, or if you feel like you've been struggling, begin a pain diary, fill it out for 7 days, look for some patterns, just gain some information. Then every morning, start doing 5 minutes to challenge troublesome movements or activities. Pick a movement that hurts and just start with visualization, slowly doing 10 to 20% of the movement, then maybe going a little bit further into it, and see if you can slowly build into the movement better. And do a little neuroplastic strengthening. Once a day for a minute, try to focus on that one shiny object without acknowledging the pain. So you're gaining information, you're starting to move a little bit, and we're going through the neuroplastic strengthening. So it's allowing you to challenge some of the key pieces to at least get things rolling. And remember, acknowledging without emotion is important. Like I have someone that I'm working with one-on-one who has migraines, and once some of the triggers that trigger them start coming, she's been kind of going through her head, acknowledging without emotion. One of the things I tell people to say is like, I know this is pain, it's in my brain, I will retrain. And you just keep it non-emotional, and how often that it doesn't turn into a migraine because of that. So this is just like a little starter thing. Anyone who's in the program, it's a good refresher, but we don't have to, you're already in the program. Okay, we'll go into a Q&A.